hospice group, and I'm a geriatric certified specialist. This is my email address. It's also in your resident handbook. If anybody has a follow-up question after we're done today, I think that we're supposed to be limiting real face-to-face conversations about things and questions that aren't necessary. So please feel free to email me if you have a follow-up question that you don't want to talk to the group about. So we are going to talk about dizziness today and vertigo. This tends to be a kind of popular topic with the crystals. Everybody gets, oh, my crystals are out, my crystals are out. Has anybody heard that expression before? Pretty much everybody, right? All right, so crystals are actually one specific type of vertigo. So we are going to get to that, but to start with, we're going to just kind of touch on an overview of what can cause dizziness. I think it's very, very important that we're all aware that it's not just crystals, because some of these things are very critical for us to see a doctor, okay? So vertigo just actually means spinning. It's more of a symptom that means spinning. It's not a diagnosis for crystals. So if someone says to you, I have vertigo, or the doctor says, okay, do you think you might have vertigo? That just means spinning dizziness. It doesn't tell you what's happening. Likewise, when somebody comes to me and says, hey, Ashley, I'm dizzy, that brings a whole lot of questions to my mind. I want to know more. I want to know, is there another word that's maybe more specific that you can tell me about your dizziness? So are you actually spinning, or a sensation that the room is spinning around you? Do you feel like you're tilting? There are some conditions that make you feel like you're more bouncing, where your vision is just not stable. I get faint, I get lightheaded. Some people tell me that they're swimmy-headed and they're woozy, and what they really mean is they're just kind of off balance and they can't find that equilibrium. So the first thing that a doctor or a therapist is going to ask you is, tell me more. Can you be more specific? It's also important if there's other things that come to mind that, oh, when I get dizzy, I'm nauseated. Or when I get dizzy, I get the sweats. Okay? So, normal does not equal typical. There are so many things that can cause dizziness. That dizziness is a very common complaint. Just because it's a common complaint doesn't mean it's normal. It doesn't mean that it's something that you should just say, okay, well, everybody has this, I just have to live with it. We want you to tell somebody. This is actually the third most common reason that people show up at a doctor's office is dizziness. So dizziness can be, of course, medication side effects. I know everybody's probably read that on every single medication label that they've ever had. May cause dizziness. If you're having blood pressure problems, excuse me, whether that's too high or too low, if you've had a history of some heart arrhythmia, if you've got problems with your sugar, if you have migraines, migraines can actually occur in the part of the brain that makes you dizzy and it impacts your equilibrium. That's actually more common with women, particularly when we hit times of life where our hormones are swinging. Dehydration, low blood counts, any problems with vision, anxiety, all these things can cause dizziness in addition to the inner ear disorders, okay? I think I may have heard somebody had a question or comment. Did I hear something about dehydration? Oh, okay. Everyone needs to make sure they drink plenty of water. That's okay. I think that's probably a good point for harassment for all of us. We need to make sure we drink plenty of water. Dehydration is critical for so many things. So water, water, water. All right. So this is just for fun. So you go to the doctor and you tell them that you have dizziness, and if your doctor happens to be the vet that's seeing your dog, he may tell you to stop chasing your tail. That's going to be our prescription to fix it all. All right. So vestibular dysfunction is going to mean specifically problems with the inner ear as they relate to dizziness. Over half of the people that are considered geriatric or over age 65 have had a problem with dizziness or imbalance that is related to the inner ear, okay? That means there's still a whole lot of other people that have one of those other reasons for dizziness that we've talked about, but half have a problem with the inner ear. You can have multiple problems causing dizziness at the same time. 9% of people that live in the community, so that would be like you folks here, people that are not in assisted living or in healthcare, people that are able to function independently and go about their business, 9% of those have undiagnosed BPV or crystals, okay? That is very treatable. It goes undiagnosed a lot because the older we get, the more other health conditions we have, the more other medications that we're on, and the more we think it's just normal to be dizzy. And we want to debunk that myth. Dizzy is not normal. All right? So what is the vestibular system? The vestibular system is what is responsible for our balance. Okay? So when we look at balance, we have vision. So I'm looking at all of you right now, and I'm trying to keep my eyes level. My gaze is going to stay level, and it's automatically telling me to orient myself to the horizon. Okay? It's been doing that since I was a child. That's going to help keep me level and balanced this way. Okay? Proprioception just means all the nerve endings that are in our major joints, that are in our feet, that tell us where we are. So, for example, if you have problems with neuropathy, whether that's from diabetes or chemotherapy or something that has impacted your ability to feel, or maybe you've had a joint replacement to where you don't know exactly what your needs are, that's going to also impact your balance. And then our third sensory system is going to be the inner ear. The inner ear's job is to tell us if we speed up, if we slow down, if we tilt, if we turn, anything that's going to change our body position. We're supposed to get that information from the inner ear. That inner ear is then going to take that information and it's going to kick it to our brain, and that part of our brain that does balance is going to say, okay, leg, this person is tilting away. You need to push back to get her upright. Get those eyes level to the horizon again. Okay? Or it's going to say, okay, well, she's speeding up this direction. You better step faster to catch before she falls forward. Does that make sense? So all three of these things need to work together. We have vision, because we're going to stay level. We've got feeling in our feet. And then we've got that inner ear saying, okay, well, she sped up, she slowed down, or let's fix it. All right? So we have our lovely ballerina here. You can imagine that if you don't have a strong inner ear, ballet is not the sport for you. But again, turning, bending over, speeding up. Okay? So this is what it's going to look like. Kind of a gyroscope looking setup within that inner ear, and it's got 3 different loops. Horizontal. This loop right here is going to tell me it turns this way, like my head no. Okay? We have this posterior semicircular canal. This guy is going to be more of a tilt backwards. So think reaching up for the light bulb, reaching up in the closet, tipping that head back to wash your hair. It can also mean that, okay, well, it's time for me to go to sleep. I'm going to lie down on my side or my back, and my head tilts back, okay? And then lastly, we have, this is called superior or the anterior semicircular canal. This is going to be more forward bend. So bending over, picking up a shoe, something off the floor, getting that head tucked down between the knees, and then coming back up, okay? Now, this guy right here, the posterior, is the most common culprit for the crystals. So I'd be willing to bet if we took a pretty informal poll in here, most people that have had some vertigo and related to crystals, it's been more the tilting or the lying down that have gotten them. That's the most common culprit. The reason that is because right in here is where the crystals are supposed to live. Okay? This is called the utricle and saccule. The crystals actually live there on purpose. They utricle and saccule, it looks like a jello. So I want everybody to think of a plate of jello. And I want you to think about putting just little crystals on top, or just little teeny pebbles. So you're walking with your jello and you're speeding up, and then when you slow down, that jello does whoosh, right? You know how it kind of wiggles and then comes back? So crystals are sitting on top and they're weighting that jello, so you get a very obvious shift in that jello's mass and come back. Spout up or slow down. It works beautifully, but it dries out. This is why it's more common as we get older, things just dry out. The jello dries out, the crystals break loose, so then we're moving around and we're doing our thing and we're fast, or maybe we've bumped our head, and the crystals come out. And most things, when they come loose and they fall down. So this is the direction that they go, and they end up loose into this canal. Okay? So we've got loose crystals now. We go to tilt the head. As we tilt, this whole mechanism shifts and the crystals go back this way. This is a circle, therefore we feel like we spin as the crystals move around. Okay? We need information matching from both our right and our left. Otherwise, we spin really, really, really hard. We have to get agreement between both sides. If that information doesn't match, or what we're feeling from our inner ear doesn't match with what we're seeing, then we end up with what we call dizzy. And maybe you've seen, like you're at a stoplight and you see the person next to you start to move, and all of a sudden you kind of panic and you slam on your own brake, and then you realize you didn't actually go anywhere. That's because your vision is telling you one thing, your inner ear is telling you something else. And it's taken your body and your brain a second to realize what to attention to get your equilibrium right. This is a very similar concept. It's just between right and left in the inner ear. Does anybody have any questions so far? Okay, cool. So this looks complicated. We're going to make it very simple. Is all those senses, so vision, inner ear, feeling in our feet and our joints, telling us where we are in space, and then telling us, okay, here's what I want to do. I want to step over, the rock in front of me or the cord in front of me, or I want to speed up. And then your brain takes all that information, shoves it over to your muscles and says, okay, here's what I'm going to do. Here's how I'm going to need to react. In those muscles, you make the movement, you step. You either stub your toe, in which point your senses tell you that you're kind of tripping and tipping forward and you feel it and you correct, or else you don't feel it and you don't send information and you don't fix it. So this is just it's a constant feedback loop. Okay? So when we have undiagnosed vertigo, and I'm saying vertigo very generically is that feeling of dizziness and spinning, not necessarily crystals, okay? When we have undiagnosed vertigo, we have independence. Daily tasks. So daily tasks for most people when they do research, it's going to include things like, can you shower by yourself? Can you make your own meals? Can you get dressed, including bending over to get a hold of your shoes without feeling like you're going to fall on your head? Can you go out to the grocery store, including driving to get there without feeling like you're too dizzy to drive? That type of thing. We're going to have increased falls when we're dizzy and off balance, and because we're less independent or more likely to fall and fearful, then we get higher rates of depression. This makes dizziness a very, very, very important thing to address and address early. Okay? So we've been to the doctor. We have decided we don't have a heart problem. We don't have low blood. We're drinking plenty. Our blood sugar is good. Everything else is great. So it looks here. We've already established that. We get to the inner ear, and we're going to go see an ear, nose, and throat doctor or a therapist who's trained to assess for the inner ear. When we look at it, we're going to say, okay, we've either got a peripheral problem, which means the inner ear itself, or a central problem. Central means that it's actually the brain that's causing problems with how the brain and the inner ear coordinate, okay? So peripherally, we're going to have BPV, benign positional paroxysmal vertigo. That's our crystals. That is the number one most common. We also have pretty high frequency of what we call hypofunction. A hypofunction just means that you're weak. You have some nerve damage on one side or one ear. That is very, very common if there is sensory neural hearing loss. So if you're somebody that's had hearing loss, stronger on one side, then you're more likely to have a hypofunctioning system on one side and therefore get dizzy when you turn or when you move quickly because of that. Sometimes we can...
What could cause the nerve damage? What's typical causes of nerve damage?
So when we look at hearing loss, if you have been an audiologist, you have conductive hearing loss and sensory neural. Conductive is more problems with the bone. In the bony conduction. That does not impact. If it's sensory neural hearing loss, that's typically things where the nerve itself has been damaged. So you can have loud noise over time. You can have things like ear infections that have caused what we would call a labyrinthitis, meaning that entire structure in the inner ear has gotten infected and inflamed.
How about loud noise when you're, let's say, a teenager in college working in a very, very noisy
That can do it.
can plant for 2 months?
That can do it. I apologize because I don't recall the exact decibel level, but there are actually studies that show that if you are exposed over prolonged exposure to certain decibel levels of noise, then it can damage your hearing. Now, I would say that's more likely to cause bilateral or hearing loss on both sides, but it can happen. I also have a friend, this is a young guy, he's in his 30s, but he was in the military, and he had someone who happened to fire a gun very close to one side of his head when he didn't have hearing protection on. So his hearing is basically gone on one side and the other side's fine. So that's another example of what can do it on one side. But you're also looking at, like I said, ear infections, sinus infections, anything that's going to inflame just one side of that bony labyrinth where structures are housed can cause damage to that one side. A lot of times, people who have some hearing loss are already aware of it, and if they're not, their family is aware of it. So sometimes when I evaluate folks and I'm asking questions, the person will tell me no, and their wife is sitting right there with them and saying, yeah, honey, actually your right ear is a whole lot worse. So sometimes it's helpful if you're not sure, if you can have an audiology test, or just to ask some family and friends if they've noticed that you're struggling with that a little bit. Rarely people have problems with Meniere's disease, superior canal dehiscence, schwannomas. Those are big, crazy sounding words that don't happen very often, but they can happen, okay? It used to be that doctors told everybody they had Meniere's disease if they had recurrent dizziness. We now know that that is not true. Not a specific known cause for Meniere's. We know that there is pressure and fluid that builds in the inner ear to cause that. So when people have Meniere's, their balance, their dizziness, as well as their hearing tend to wax and wane over time and kind of self-correct and then get worse and self-correct and get worse, okay? That's very, very uncommon. Most people we're looking at one of the first three if it's a problem with the inner ear. And then, of course, yes, ma'am.
Back to the bilateral loss.
Mm-hmm.
Can it be like at a certain level? I mean, I've noticed that Greg can't hear some things at a certain level. Frequency.
That's actually typical, yes. Mm-hmm. Usually higher frequencies go first. Yeah. If we're looking at central function as far as how the inner ear and the brain work, anyone who's had a stroke may complain of spinning dizziness. They may also complain of tilting or bouncing because their equilibrium's off. Same thing with Parkinson's, multiple sclerosis, any type of brain injury or concussion. I will also add that if somebody has had any of these neurological problems, if they are having trouble with their vision, that's what the oculomotor means. If there are problems with their vision tracking and being able to follow objects, being able to follow reading, sometimes if we've had a real good hit on the head, if things are close to us, we have trouble with our eyes kind of cutting in at the same rate. All of those things can make us and make it difficult to figure out how much is inner ear versus how much is your brain. Okay? All right, so when are we going to be suspicious of inner ear? Obviously that dizzy or spinning sensation. Headaches. So if you are constantly working and trying to figure out, do I pay attention to my inner ear or do I go with what my eyes are telling me? If you're doing that all day long to try to figure out your balance, usually you start to get a little bit of a headache. If you feel like your eyes are jumping around because you're constantly having a sensation that you're off equilibrium, you're going to get a headache, particularly if you're trying to read, if you're working on the computer, if you're in the car and you're passing like lines of trees and things at a rapid rate and you're trying to figure out what's happening between your inner ear and your eyes, here comes that headache. Nausea and vomiting, nobody's favorite, but that comes very frequently. Sudden worsening of balance, I think that speaks for itself. And head trauma. Now, I've got on here worsening balance and staggering gait. I want to be very clear that that is still the ability to walk. It may be that you're walking with somebody holding your hand, or maybe you had to grab your cane to steady yourself, but you can still coordinate one foot in front of the other to step. If you cannot coordinate, if you wake up in the morning and you are dizzy and you cannot coordinate how to put one foot in front of the other, or at least coordinate crawling, that is a 911 phone call, okay? All right, so it's not common, but that is a 911 phone call because that indicates a potential for a stroke. So if you are dizzy and you cannot coordinate walking or crawling with help, then it's 911. All right, we'll back off of that serious point now. All right, so we think it might be his inner ear. Volunteering to help him get up. All right, so Otolaryngology, basically this is just the academy that does ear, nose, and throat problems. Of patients who go to the doctor with vertigo or dizziness, 17 to 42% are diagnosed with crystals out. In my mind, I hear 17 to 42% and I think, golly gee, that's a huge, huge margin, okay? But so to clarify that a little bit, whenever we report statistics, we are giving standard deviations, and usually they report the range is 2 standard deviations. That means basically from the middle, how far out is the data, okay? So think somewhere in the middle there is how many people are accurately going to have crystals out when they go to the doctor. That's a pretty high percentage when we think about all the other reasons that people can be dizzy. Almost half of the population has at least one episode of BPV in their lifetime. A lot of those people can have recurrence over a lifetime, okay? So just because you've had it once, and maybe you went to see a physical therapist, to see an ENT, and they flipped you over and they rolled you around, doesn't mean it can't come back. And remember, we're talking about these little crystals, these little rocks on Jell-O that's drying out. That's why it can come back. That Jell-O continues to lose water and kind of desiccate over time and things pop loose, okay? So just because you've had it treated and fixed before, don't assume that, oh, that can't happen to me, I don't need to go back. All right, so what do? We said you're going to see a doctor. You're going to report any pattern or problem. So you say, okay, doc, every time I get dizzy, I get nauseous. Or every time I get out of bed in the morning, I spin for, half a minute and then I'm good the rest of the day. Anything like that is going to help your doctor or your physical therapist figure out what's going on. You want to make sure that you talk to the doctor about whatever medical history and medications you're on. This is especially critical if you go to multiple doctors to where your primary care may not know what maybe your cardiologist changed last week. And then you're going to ask for a referral for therapy. A lot of people will ask for a dizzy pill. A dizzy pill would be something like meclizine or Antivert. Has everybody heard that term before? Okay. The way the dizzy pill works is that it basically puts your inner ear on Benadryl and just kind of tells it to go to sleep. So your brain is no longer getting good quality information from your inner ear. It's also not getting bad information from your inner ear. So good news, you're not spinning, you're not nauseous anymore, but you're also not going to get the information you need to balance yourself once the crystals are fixed, okay? So if you feel like you're sick and you want that meclizine and that Antivert, the prescription from the doctor usually says 25 milligrams, take every 4 hours as needed. And we want to highlight that as needed part because if you've been treated by the therapist and it looks like you're getting better, or you wake up in the morning and you're not as dizzy and you're not as nauseous, you don't want to take that pill anyway because that means you're not getting the good balance information, and we sure don't want to have a fall just because we kept taking something just because we were scared of the feeling. Okay? When you see the physical therapist, they're going to test you and they're going to say, okay, let's move around. We're gonna look at your eyes and we're gonna tilt you, and we're gonna see when we tilt you back, are your eyes spinning? Are they bouncing? Are they doing this? Or are they nice and steady? We're gonna see how long the feeling lasts. We're probably gonna check your blood pressure and check your balance, and then we're gonna use all these things together to determine, is it just crystals? Is it not crystals at all, and maybe it's just a weak inner ear that we need to address? or is it crystals plus some sort of other balance have a plan for? So if it's just crystals, we're going to talk about canalith repositioning. That includes things like the ever famous Epley maneuver. And then if it's other things, then we work on balance exercises. We work on exercises for the inner ear. We talk about shoes. Shoes give us stability. Shoes help us to have more input to help those sensory and those nerve endings down in our feet have good awareness of where we are, and they also physically help to support our ankles to give us some balance. And then we talk about compensations, because there's some things that we can fix, and there's just some things, like if you've got nerve damage, that we can't totally fix. So we talked about the rolling around for the BPV. Posterior canal is going to be the most common. So here's where the crystals live. The crystals have dropped out, everything's dried out, or we got hit in the head and they dropped out and bottomed out. So then I lie down. When I lie down, my head's going to tilt and those come down. I feel like I'm spinning or the room is spinning around me. However many seconds it takes for those crystals to move from here and get to this bottom point where they're no longer going to be moving around again. Okay? So this is in bed, and maybe you spin for 10 or 15 seconds, and then all of a sudden you're like, oh, it's gone, I'm good. And then you sleep for, or maybe you sleep for a couple of hours before you roll over and have to get up and go to the bathroom. Well, then you roll over and you get up, and here go the crystals. We're standing up, so they're going to drop back down here again. And we spin again for a few seconds, and we get a little nauseous, and then we wait a little bit, and then it's gone. Okay? That's what's happening. So when we do what we call canalith repositioning, we put you back in that position where they bottom out here, so you get dizzy, and then we're going to start to roll you and tilt you in specific ways so that those crystals can move all the way up and around and park back where they're supposed to be. And the body has a really, really cool way that it tries to help you compensate, and that if we can get those crystals back home in about 24 hours, they'll actually dissolve, and then you're not dizzy anymore. We just got to get them back to home base for the body to do the rest of the work. All right. So for those of you who were here before we started, all that racket that you heard was where the computer was supposed to be playing a video for you all to see the eye movement and actually see what happens as the person changes position with some infrared goggles over the eyes. As most of you heard, it was a deafening noise and the video never came on. So we are going to skip that part. If you are interested and you really want to see these videos and see what it looks like, shoot me an email and I'd be happy to send you a link so that you can actually watch the videos on your own computer. Okay, I'm happy to do that, but we're going to spare everybody's ears today since the audio was not wanting to cooperate with us. All right. Can you all see this picture? It's a little funny at the lighting. So this is just working through that Epley maneuver, again, for the posterior canal because it's the most common. So person sitting up tall. So it's showing where our crystals are here. They are going to lie down and they're going to really exaggerate that head tilt back. So now we have crystals that are moving here and they're starting to go down, down, down this way. And then the person drops their head back and they start to turn. As they turn, the crystals start to work their way here. Okay, we're turning some more. We're rolling onto our side. We're still looking down. And then here come the crystals completing the loop, and we're back to upright. They're back where they're supposed to be. Okay, what if it's not crystals? If it's not crystals, if the inner ear is weak, there are exercises that can be given to help you learn to accommodate. Physically inclined? Instrument? No. We got one. All right, this will make sense to one person. All right, so remember we said right and left have to match. So when you're moving, right and left, those nerve impulses from the inner ear should be the same. Okay? So it's the same. Normally if I turn, I'm going to turn my head this way, this one speeds up, this one slows down, so it's a perfect subdivide of that beat. I know you're with me. Is anybody else with me? So this speeds up. This is like you're clapping to the music, halftime. This one's double, this is half. So it works perfectly, okay? If this inner ear is weak, This is not going to speed up enough, but this one's going to slow down. All of a sudden, our two tunes don't harmonize anymore. Things no longer make sense, and we're going to get a little bit dizzy, okay? The exercises are going to be working on turning and trying to help our brain figure out how to reset this side so that all of a sudden we have harmony again. This one's never going to be up to fast speed. This one can adjust though. So we're working on the exercising. Our smart brains are learning how to adjust, so all of a sudden we're back in harmony and we can turn our heads and walk and look around without getting pretty cool that our brains are capable of learning that, but we have some simple exercises we can teach to help with that. And then we're going to talk about balance training. In order to have your balance, you need those senses working. You need your vision. You need your inner ears. We need good feeling. But we also need flexible muscles that are capable of helping us to adjust. So if we're so tight that we're start to stumble and we don't have the ability to straighten up to help pull us back, we're already half fallen over. We need flexibility. We need the strength to be able to push ourselves back upright if we do start to stumble. We need the ability to react quickly, which is a little bit of reflex and a little bit of strength. So we're going to work on some of these things for balance. The inner ear exercises, and we may have to talk about, okay, does this person need a cane? Do they need something to get them over the hump? Because the last thing we want is a fall. Something else that's critical, if you're not having BPV, it's not the quick fix, is to make sure that your prescription of your eyeglasses is right. Particularly if you're somebody with bifocals or trifocals, making sure that it's what you need so that you're not getting dizzy as you transition or as you turn and look around. Making sure that your eyes are able to actually do what they need to do to give you good information. And then safety strategies at home. Night lights. As we age, nobody's fault, it happens to everyone, but as we age, our eyes accommodate to changes between light and dark much more slowly. Much more slowly. So when nature calls in the middle of the night and it's pitch black and we don't necessarily have a couple minutes to wait on our vision to catch up, we're at risk for falling and we're at risk for feeling an increased sense of disequilibrium and dizziness if we already have a weak inner ear, because that's not giving us good information, and then all of a sudden our eyes can't help compensate. So the night light so that our eyes can help compensate, okay? Sitting on the edge of the bed for a few seconds. This is a super strategy that we recommend for everybody, whether you have problems where you pop up and, ooh, there goes my blood pressure, or whether you pop up and the room is spinning for a few seconds. Sitting on the edge of the bed for a little while can help. It gives you just enough time to get your equilibrium, and then you get up and you go to the bathroom. We talked about shoes to help with balance, okay? So these are generics. We can have more specifics based on people's individual situations. All right. Ma'am? Oh, sorry. All right, so just to recap, physical therapists are equipped to work with individuals on positional vertigo as well as inner ear weakness, as well as just general balance dysfunctions. We like working with you on an individual basis to try to figure out the exact problem and a plan that works for the individual. However, the Wellness Center, Denise, has great resources in there. There is an entire balance center where you have a bar that wraps around to practice. There are bars in the exercise room that you can grab hold of. There's classes. They can work and help you with things one-on-one, because remember, strength, flexibility, all those things are critical to being able to have good balance. The more you move, the better off you are, whether it's just weakness or whether it's inner ear. If it's inner ear and you're at least walking and you're doing things, then your body and your brain compensate, okay? If we don't do anything and if we give in and just sit there, then our bodies can't figure out what to do with it because they're not getting any information, and every single time we get up, we're going to feel disequilibrium. So I think, as always, you don't have to know everything, but you do have to know what to ask or be willing to ask. Right. Did you have a question, Ms. Archie?
How is Westminster Canterbury ready to help like this? Do you have someone here that could help?
Are you meaning helping for physical therapy, or are you meaning helping for, like, in the wellness center?
Well, physical therapy, fine, no, for this type of problems, where the crystal goes. Do we have?
So
every-
crystals are going to be with a physical therapist. So that would either be with me, or there's a therapist that's on the 6th floor on the new Drinkard building that can help with it as well. Or I can help, since I work with home health, I come to you.
Okay,
In that case, you would go to them, and Dr. Lord or whomever your primary care is would just write a referral. Oh, I'm sorry.
That's okay.
So there is, I'm a physical therapist with home health. I can work on the crystals and work on some of these balance and vertigo needs in your home if that is the need. If you don't have a need for someone to come to you, Westminster Canterbury has a physical therapist on the 6th floor in the new Drinkard building that can also help. That would just entail you having to walk over to that space. Okay? And then whoever
You
your
can't get there now.
the last I heard, they were allowing.
Okay.
Yeah, Denise, do you have any updates on that?
Last I heard, they were still doing physical therapy, but I could ask and get more information on that. Sixth floor, yes, hard side. Okay, sixth floor, hard side.
Okay, so she said they moved it into Harside. They're not using the rehab space in the Drinkard at all? Okay, so they've moved it into the Harside building, the old building.
I could get more information on that. We have contact tomorrow, and I'll be speaking in contact. I'll see if I can get more information on that, just to be mentioned in contact.
Okay.
Because in May of last year, I had this, and I came to your place here on first floor of the new building.
They closed, okay.
And then they told me that they couldn't help me, so I had
Who did you see on the first floor of the new building?
a young lady, but I don't remember her name. And she did whatever you mentioned, and she said, I can't help you anymore, you have to go someplace
Okay.
else.
So
that's
that
what I'm wondering.
may have been partially my fault because I was on maternity leave in May. So I don't know who was in there. They may not. Not every physical therapist is trained to do this. Like I said, I am, and I was on maternity leave in May, so that you may have just got caught with bad timing. I apologize. I had a really cute little boy, though. All right. Does anybody else have anything to ask or clarify? I know these are interesting times we're living in right now. Yes, Jerry?
I just wonder about tile floor patterns, carpet patterns.
Mm-hmm.
How much of an influence is that on your spinning and dizziness?
Okay. I'm going to be very choosy with how I say this. So tile in and of itself is not going to make you dizzy. The problem with tile a lot of times is actually glare, particularly if the tile has been recently cleaned or if anything waxy has been used. It makes it look really nice, but we were talking about changes that occur with vision as we age, and the ability to adapt quickly is not one of them. Our glare intolerance increases dramatically as we age. So if you're having tile that you're walking across and sunlight is pouring through the window and there's a lot of glare, and so your vision's not doing what you need to, and maybe your inner ear is already a little bit weak, you no longer have your vision to help you overcome weakness, and you may feel some disequilibrium. Patterns on carpet are, they're difficult. They are very difficult. This would be similar to if you were walking around a grocery store when stuff is stacked on the shelves, or you have somebody with curtains and wallpaper that are crazy patterned. Visually, and a lot of distraction. If I am looking at a plain wall, such as this lovely temporary wall over here in the Commons, and I'm easily able to focus my eyes just on that spot, and again, help me to overcome the fact that my inner ear is not giving me good equilibrium and good sense of where I am. If I'm looking at this pattern and I can't easily get a focal point, and then I'm turning my head at the same time, I can't get a focal point. And again, if my inner ear is weak, that dizziness is going to compound itself. Does that make sense and answer the question? I'll be very honest with you. Since the renovations, that has come up more than once. And since the renovations and the decor at this point are what they are, then typically we're looking at exercises to work on the inner ear and help get that music back in harmony between right and left to help strengthen that. I have also done a lot of exercises with people that are more dynamic and designed to help adapt, where we're purposely practicing, all right, I'm staring right at Hazel, and as I walk, I'm going to keep my eyes on her even as my head's moving and turning. Because if I can find a point on the wall in front of me, even if I've got all this busyness going around me, then I'm more likely to be balanced, and I'm not going to be as dizzy. But it takes practice of finding a cheat, if you will. Any other questions or comments about that? Has anybody found a specific strategy that's worked for them or a specific environment that's really not working for them that they want to open up to the peanut gallery for comments?
I have a question about evaluation. Back up to that.
Yes, ma'am.
So if you think that you are really impacted by this, the first place you start is Dr. Laura, primary.
Mm-hmm. Yep. Dr. Lord would be your first place. Most of you,
You asked the last question you asked regarding solutions. What I found out is anytime like I'm in the shower and I close my eyes, I have to be touching the wall with
Yep.
my hands, or I'm likely to fall over and not even know it.
Mhm.
So I always make sure there are 3 points of contact. It might be vision and then
Mhm.
tactile. But I found especially I can close
Mhm.
my eyes and strange things happen.
Yes. And that's a perfect compensation. Did everybody hear him on the other side of the room? So he's saying if he's in the shower and he closes his eyes, he's all of a sudden kind of dizzy and swimming, and he has to reach out and make sure he's grabbing something. That's, again, one of those compensations that he's telling me he's got some sort of inner ear problem. Whether he's got crystals or whether he's weak, I don't know because I haven't evaluated him. But he's telling me that he's not getting good information from his inner ear. So there's 1/3 of his balance information gone right out of the gate. And then he closes his eyes and there's another 1/3 and he's dizzy. So he's got to reach out and he's got to increase his sensory where he is that way. And that's a perfectly legitimate response. That's also why we tend to say, hey, do you have grab bars in your bathroom? They're very helpful for stepping over and into the shower, yes, but also for such time as that when you need something just to steady yourself. I'm going to come back to your question for Dr. Lord or the primary care. Most of you, I would imagine, have Medicare at this stage. Because of the way Medicare is structured, Medicare requires that you start off with a physician's prescription before you see a physical therapist, okay? Now, if you don't have a whole lot of medical history going on and you call and say, hey, I'm spinning, and they know you've done this before, then they very well may just send an order for therapy without you having to see them. But if you're somebody who's got a lot going on and there's heart history there and you've had a tendency to have your sugar go up and down, or they know they changed your blood pressure medicine a week ago, then they're likely going to want to see you. And that's for your safety. We want to make sure we don't miss anything that could be more catastrophic than just feeling nauseous every time you get out of bed.
What is some days you are very off balance and on other days you can be just perfect?
That is a good question. So she said, why is it some days you're really off balance and other days you feel perfect? And it's a really good question, and I will say that I cannot answer it exactly for you without seeing what's going on. I can tell you in general, there are some things that could be contributing, okay? So starting with, are you having fluctuations in your blood pressure? Are you drinking enough water? Have you slept well? That type of thing, because that's going to impact how you feel. If it's more of an inner ear thing, remember we said crystals can kind of come and go and then recur later. There's also issues where if we're not well slept, it disrupts our ability to compensate in general. So if you already have an inner ear problem and your crystals are out and you didn't sleep well the night before, your brain is kind of foggy and it's kind of sleeping, and it's not helping you to adapt and accommodate to the other problem that you have. Okay.
I've noticed a direct correlation with the amount of sleep I get and how dizzy I am when I get up in the morning.
Yeah.
Very clear.
You know, I think sleep is one of those things that's fascinating because it's becoming an entire science to study sleep. Hard work with all things good, and sometimes hard work means not sleeping. And we are, in more recent years, finding out that sleep is actually critical for health for quite a variety of reasons. So don't tell yourself that you're being lazy. Go ahead and get in bed. Take the nap if you need it. It's actually critical for your brain health and your heart health. Yes, ma'am.
I've had trouble if I put my foot down, I think it's going on a flat surface and there's a stone or a stick or something I don't see. And if I put that mine totally flat, then I'm kind of off balance and I can't recover. Why is that?
Again, generically speaking, I think you would probably need to have some things assessed, starting with your strength and your ability to react. Because if you don't have strength and flexibility to have, good upright carriage when you're walking around to start with, or you don't have strength to really, lift and quickly recover, then you can step on the time and it can go off. So again, not concrete advice because I haven't assessed where you are right now as an individual, but I think that's something that you may want to look into more from a strength standpoint. All right. So I know I said this like probably 5 times or 100 times, but remember, dizziness is not normal. It may be common, but it's not normal. We want to have good balance. We want to stay active. Please report any sensations of dizziness or disequilibrium to the doctor, okay? Alrighty, so again, this is me. If you all do want a video so that you can see what the eyes do and actually see the evaluation and treatment process, I'd be happy to send you that link via email since we couldn't get the video working today. Otherwise, feel free if you have any questions that you don't want to throw out to the group. I'm completely open to them. And thank you all for being patient today. I know this is an entirely different setup and environment and structure for everything that we do as we go through COVID, but it's good to get to see a few of you again. So, any other questions or comments? Yes, ma'am.
I have fibromyalgia. So